Hey there, health pros! Today I'm diving into the fascinating world of the elbow joint. Let's break it down, nice and simple. First up, the bones. The elbow joint is like a complex hinge made by three bones, the humerus, the radius, and the ulna. Picture the humerus as the upper arm bone. Now, its distal end forms the upper part of the elbow with the trochlea and capitulum playing key roles here. Next, the ulna. It's the medial bone of the forearm on the pinky side. The olecranon and coronoid process here fit neatly into the humerus. And don't forget the trochlear notch, creating that perfect hinge. On the lateral side, we have the radius, the bone on the thumb side. Its head articulates with the capitulum of the humerus and the radial notch of the ulna, allowing for those smooth hinge and rotational movements. Now, onto the articulations. The elbow joint has three main ones: the humerulnar joint, the humeroradial joint, and the proximal radioulnar joint. Each of these contributes to the specific movements and stability of the elbow. Speaking of stability, let's talk ligaments. The ulnar collateral ligament, or medial collateral ligament, provides stability against valgus forces. It's got three parts: the anterior band, posterior band, and oblique band. Then there's the radial collateral ligament on the lateral side, giving support against varus forces. And let's not forget the annular ligament, which keeps the head of the radius snug against the ulna. Muscles are next on our list. For flexion, we have the biceps brachii, brachialis, and brachioradialis. For extension, it's the triceps brachii and anconeus. And for those rotational movements, pronation and supination, we rely on muscles like the pronator teres, pronator quadratus, and supinator. Don't forget the olecranon bursa. It's that fluid-filled sac, reducing friction and preventing irritation during movements. Now let's break down the movements. Flexion brings the forearm closer to the shoulder with a range of about 0 to 145 degrees. Extension straightens the arm with the same range. For pronation, the palm faces downward, thanks to the pronator teres and pronator quadratus, with about 0 to 90 degrees range. Supination, rotating the palm upward, involves the biceps brachii and supinator, also with a 0 to 90 degrees range. So there you have it, the elbow joint, a marvel of anatomy, allowing for crucial movements. Understanding its structure and function is key for any health professional.